Rick Bright, the ousted director of a crucial federal office charged with developing countermeasures to infectious diseases, testified before Congress on Thursday that the U.S. will face an even worse crisis without additional preparations to curb the coronavirus pandemic. "Our window of opportunity is closing," Bright said. "Without better planning, 2020 could be the darkest winter in modern history." Live updates. Rick Bright testifies. Bright criticized the Trump administration for failing to implement a standard, centralized, coordinated plan to combat the virus and questioned its timeline for a vaccine. His testimony came a week after filing a whistleblower complaint alleging he was fired from his job leading the Biomedical Advanced Research and Development Authority for opposing the use of a drug frequently touted by President Donald Trump as a potential coronavirus treatment. About an hour before Bright's hearing, Trump tweeted that he had never met or even heard of Bright, but considers the NIH senior advisor a disgruntled employee, not liked or respected by people I spoke to and who, with his attitude, should no longer be working for our government. Before the House Committee on Energy and Commerce's Health Subcommittee, Bright urged the Trump administration to consider a number of actions, including increasing production of essential equipment and establishing both a national test strategy and a national standard of procurement of supplies. He calls on top officials to lead through example and wear face coverings and social distance. Bright claimed that the administration missed early warning signals to prevent the spread of the virus. He said that he would never forget an email from Mike Bowen, the hearing's other witness and the vice president of the medical supply company Prestige Ameritech, indicating that the U.S. supply of N95, the respirator masks used by healthcare professionals, was at a perilous level. He said, "We're in deep shit," testified Bright. "The world is." Bright said he pushed that warning to the highest levels he could at Health and Human Services but received no response. "From that moment, I knew that we were going to have a crisis for healthcare workers because we were not taking action," said Bright. "We were already behind the ball." In his written statement, Bright blamed the leadership of HHS for being dismissive of his dire predictions. Bright wrote that he knew the U.S. had a critical shortage of necessary supplies and personal protective equipment during the first 3 months of the year and prodded HHS to boost production of masks, respirators, syringes and swabs to no avail. He alleged that he faced hostility and marginalization from HHS officials after he briefed White House trade advisor Peter Navarro and members of Congress, who better understood the urgency to act.